Welcome back. You're still watching Daybreak on this 22nd day of January 2024. I've been listening to some interesting stories here. I'll never share them until the owners share them. Now, last week, excuse me, the Court of Appeal lifted orders against some 3 health laws, paving the way for implementation of the Social Health Insurance Fund. Of course, the President has been speaking about this. The Ministry of Health has been speaking about this as one sure solution to the challenges, excuse me again, facing the health sector. Sylvanus Osoro, talk to me about the plan when it comes to implementation of this Social Health Insurance Fund, because we've been waiting for the regulations. Of course, the ministry has been saying they cannot release them because of the stoppage orders that were at the High Court. But what have you heard in terms of what you should be expecting?
There has been so much, people have really said a lot about the Social Health Insurance Fund. And they are misguided. And I think it's important for us sometimes to get this opportunity to explain to people on what exactly we mean. NHIF as currently is, as an act, does not really set up the base that is equitable, or rather, it doesn't form the equity format of contribution amongst the members of the society. That a person like myself, who earns more or less over 500,000 shillings, pays a similar amount as another person that earns 10,000, 20,000, or 30,000 thereabout. That is not equity. That is really taking advantage of the position that I hold in society, possibly, or disadvantaging the less fortunate person. So what the scheme is about is we're setting an equitable setup of contribution where you pay money that is commensurate to what you earn. A percentage that is why we came up with a percentage structure. So that if I earn over 500,000, whatever I pay is not what a teacher who earns 20,000 or 25 or 30,000 pays. What ideally that means is that we'll have enough amount of money or quality contributions that will be able to cap this, and that is why we set up the levels of free health coverage. From level 1, there is level 2, level 3, level 4, below that those levels, when you go to the hospital, it's free because somebody has contributed. You've also contributed an amount that is commensurate to your contributions. So what this scheme is about, it's setting an amount, a pool of amounts that will be able to help us as a country mitigate these health challenges that we currently have. Because as it is right now, NHIF cannot really mitigate the challenges of healthcare. You go to the hospital, you're told, it can only pay bed.
So is the challenge with NHIF about money, or it's just how it's been managed?
It's both. We are not only just changing the structure of contribution. It's also both. And you really can't blame just entirely management alone. Even if you manage it well, whatever level that you manage it, if you are contributing 500 shillings and you're earning 30,000, and I contribute the same 500 shillings, there is no equity there. So even as we change the management structure, then we should also change the contributory measure. And that is what you are doing.
Have you heard of, have you seen the regulations themselves?
Yes, I've seen them, but it will be premature to share now.
I'm not asking you to share, but I wish you could anyway. But the conversation had been the contest between, is it 2.75% without a cap or with a cap? So what is effectively in the regulations now?
There's so much that needs to be reviewed. But the percentage will be a cap. Like if it's 5%, it's not more than 5%. It shouldn't be not more than 5%. It should be between 0 point something percent to 5%. And that is what even...
So is this hypothetical, or it's what is in the text of the regulations?
That's why I said we shouldn't share now the regulations until they are brought, of course, before the...
No, you see, Honorable Osoro, let's just be honest here. The President has spoken about 2.75%. The CS for Health has spoken about it. My question is very specific. In the regulations, is there a cap or not?
There is a cap.
Of what?
Not more than 5%.
What do you
That's
mean?
not possible. If it's 2.75%, it's already under
Because
5.
it's a subject of discussion. Of course, currently it's 2.75%.
Can I just come in? Okay. My brother, you know, I'm a member of the Health Committee, and I participated in the drafting of that law, even if I had serious reservation. My brother Osoro here needs to be open. He has not read the regulations. He has not read the act. He was busy politicking.
No.
The biggest problem we have in this act, which is something that I've always raised concern about, is the lack of a capping of the 2.7%. Because if you look at, and I want to be very practical, and I'll use myself as an example. My gross salary is about 1 million shillings. If they take 2.7% of that yearly, I'll be paying about 300,000 shillings for that cover. That cover will not provide me with what I would pay if I paid 300,000, you know, for, you know, let's say Bupa or Optimum Global. I can get up to like $5 million worth of cover. So the issue is this, is what is being deducted, the 2.7%, without capping, because the story is, you know, we are controlled by the IMF and the World Bank. The IMF and the World Bank want us to tax our people all the way to their deathbed. So what is happening is that there will be no cap in the 2.7%. And this is the reason why this matter will continue staying in court. You know, it's a reprieve at the Court of Appeal, but of course it will go to the Supreme Court. Because a lot of people felt like this was rushed. You know, it was rushed. You know, there are so many things that a lot of people are concerned. And my biggest concern is on the fate of the hundreds of employees of NHIF. What's going to happen to them who are permanent and pensionable? You know, are you going to retain them? Are you going to require them to apply afresh? Those are some of the serious things that needed to be answered, but they're not being discussed. We are all focused on what IMF and the World Bank wants, tax people. So really, this 2.75% needs to be, and we're yet to see the regulations. When the regulations come, of course, they'll be brought to Parliament. Once they're brought to Parliament, we'll be able to look into them. You know, and I hope that the delegated legislation committee will actually play a key role in really trying to demystify the meaning of that 2.7%.
Do they also come to the Senate? Or?
Yes, they do. They do.
Okay.
There's no piece of regulation that will not go to the Senate. Because remember, health is devolved. You know? So, of course, they'll come. They'll be brought by the delegated legislation. And then, of course, the Health Committee will also be there, and the entire Senate will be contributing towards discussing whether to ratify those regulations or not.
Okay.
Just on that.
Just on to the question of NHIF employees, the law that the National Assembly and the Senate, or let's just say the Parliament passed,
yes.
Talks about they'll be given priority, but have to apply.
It doesn't talk about being given priorities. It actually says, I know the law very well. It says that they have to reapply. You know, yes, and that is my biggest problem. Let me tell you.
They will reapply, but priority will be given to them.
No, it doesn't say anything to do with priority. Let me tell you. You see, the biggest problem that we have is this. And this is a problem that is not starting just today. If you go into the devolved government structures, you know, when we got into devolution, a lot of local government employees, you know, were sent to counties. I don't know whether we are going to deal with that so that we have redundancy, you know. But the issue is this. I think before we even say, let's have new application, I've always had a problem with that. Why can we not just use the same employees? Why can we not give those employees an opportunity? You want to tell me that somebody has been a very senior person, he's got historical memory, he knows, he understands how the NHIF works, you know, and we're not going to be bringing something, we're not going to be magicians all of a sudden. We're going to deal with the same structures. We're going to deal with the same billing system. We're going to deal with the same hospitals. So you need people who have got experience, who have been working there. So for me, my biggest beef has always been with that piece of legislation, which I even know, of course, I participated in drafting. It has always been on the fate of the employees.
Okay. All right. Honorable Mbowe, I'll get back to you, Honorable Osoro. But Honorable Mbowe, for this question, because even page 2 of the Daily Nation, Ministry moves to effect SHIF payslip cuts this month. And of course, they're saying that the Ministry of Health is working around the clock to have regulations that will enable implementation of the Act in place this week. Is that even a possibility?
We're in recess.
You know, first and foremost, that's not possible. But you see, this government has a way of operating. We passed, in record time, about 3 health bills last session that were pushed down the throats of members of parliament by the executive. And the parliament needs to know that we are supposed to be independent. But the leadership of the majority seems not to understand that. So SHIF basically is not a bad idea. But I'll tell you several things. One, I think one of the things that happened is that this act gives the responsibility of setting the amount to be charged to the CS. And it is open-ended. And that is why now regulations need to come into place to help us now be able to demystify.
Right.
So that, in my opinion, was already a blunder, because I think the CS being given that right and, you know, to set from time to time, that's how it says. I mean, that means that then it can, under this regime that is really keen on strangling us for every last cent, that means they can even change it every year. Now, secondly, the other problem I have is that the timing is also not right, because increasing taxation, I mean, when everything else is going up, NSSF is going up, we have this housing levy that is an issue, pay-as-you-earn went up. I mean, there's too much taxation. So for them to introduce a further taxation, because this basically means we are paying more for health, that also is also a problem. And then, of course, the issue of dismissing of all the staff of NHIF. I mean, that thing of that they can reapply applies to everyone. Every Kenyan can apply. So even when they say that they can reapply, that doesn't give them any advantage. So unfortunately, that I also, you know, I differ with that. Then there is the issue of outsourcing of the most important part of or responsibility that NHIF has.
Claims.
You see, this NHIF is basically supposed to provide the insurance services. So for them to now outsource, because they're saying they will use a private you know, operator
claims
to be able to deal with claims. I mean, the NHIF and SHIF basically is supposed to deal with claims. You know, it's like your transport company, but you outsource the transport part of that company. So it doesn't make sense to me. So I think we have a problem. But I know that when the regulations come, they'll come to the House.
Okay.
And I hope that as I am part of I am a member of the Delegated Legislation Committee. And we've been thorough in this work. I hope that members will be able to look keenly at the rates that are being proposed and make sure that we cap it at a point, because you cannot have an open-ended charge on some of these things.
Right. You know, Honorable Mbui, you raised the question of NHIF, and also Senator raises it. Let me just read, I think it's in the, what part of the law is this? Okay. For lack of...
and is that the gazetted one?
Yes, the one that was signed into law. Transitional provisions, and I'm reading paragraph, what? This is paragraph 6, subparagraph, let me just find it, what subparagraph it is. 4, despite the provisions of subparagraph 2 and 3, the authority shall review the qualifications of all the staff of the fund and shall, in the appointment of its staff, give priority to the staff of the fund, meaning NHIF, who are found to be suitably qualified for the positions in the approved staff establishment. So this is what was passed by
just go back
Parliament.
and read that text clearly.
Okay, let me just read it
and then
again.
go to the first that says, despite the provision of this section.
So, despite provisions of subparagraph 2 and 3, where 2 means the Board of the Social Health Authority established under Section 4 of the Act shall competitively recruit and appoint its staff under Section 17 of the Act, subject to the approved staff establishment. Subparagraph 3 says that notwithstanding provisions of subparagraph 1, the staff of the fund are eligible to apply for the positions advertised by the authority and may be considered for appointment where they are suitably qualified. But then also says that the fund, the authority shall review the qualifications of the staff of the NHIF and shall, in the appointment of its staff, give priority to staff of the NHIF.
Exactly. You see, there are 2 things that you need to demystify there. When you read the Act as drafted, number 1, eligibility. Why would you then introduce the issue of eligibility? Yet this is a permanent and pensionable employee. You know, those are the issues. That's the language we had a problem with.
Okay.
You know, because you say eligibility, maybe, you know? And then you come back and there's shall. So, of course, there's no way you can read one section of the law and ignore the previous one. So the problem we've always had is this. If this was treated the same way that when we change into EPRA, I think the first one was called what? Before
ERC.
EPRA? Huh?
ERC.
ERC. Yeah. From ERC to EPRA, Kiptoo, who was the DG of ERC, continued being the DG of EPRA. So really, it was just the act that was changed, how they function, and that should actually have been happening, should be the same. So the problem we have, let me be very honest with you in what is happening here, is that they want to send all these people home, they bring in their own people.
That is not
That's simple. So the challenge here is, let me tell you, this new administration, the challenge here is this. We will remain in court because, one, if you are a permanent and pensionable employee, the only thing that can happen to you is for you to resign or retire. You know, simple as that. So there's no way that even if this new administration has come in, can justify in court that we are sending this person because he cannot qualify to become a member of this fund. You know, there is grandfathering of legislations. You've got to go in and look at the people who are working there before, carry them on board, continue training them. So are you telling me that you are now going to start new training for new people who have got zero qualification, zero experience of how the funds work? And let me finish by telling you this. Dealing with NHIF, I can tell you, is not an easy task. They are young men and women. They are Kenyans who work there, who sometimes we call them in the wee hours of the night and say, we need you to assist this patient. And they will wake up in the middle of the night to be able to go and assist those patients.
How about those who don't have your contact?
No, I have a contact. Exactly. That's a very good question. As a representative of the people, people reach out to me. People reach out to my brother here. They reach out to my brother Mbui. And because we care about our people, we also, and also because I'm a member of the health committee, it is in my duty to know everyone who works for NHIF, who can be able to support those members. And
the question I'm asking, because essentially, people should not have to have their senators calling the NHIF.
Well, I mean, we are represented. We are the. I agree with you. I agree with you entirely.
How do you ensure
I agree with you entirely.
Authority functions without requiring people to be calling them?
You only ensure that by doing the following. One, you transition all the people of the previous fund into the new fund. If you have any special training that you need to train them so that they don't have to call Ledama for Ledama to call them, is that you now train them afresh. And then slowly by slowly, I can tell you, we might have good intention of setting up a social health fund. But what is going to happen is that we're going to remain in court.
Okay.
Every Kenyan has a right. You know, they have their contract. They are permanent and pensionable. It is going to be extremely costly. If you ask governors of the first term of devolution, they'll tell you they had people who are drivers who are earning the salary of, what do you call it, like of a CC, and they could not fire them. You know, we talk to the people of the transitioning authority, talk to the people of the new transitioning, what is it called? Intergovernmental relations. They'll tell you we are still having a problem of the bloated, governments.
Okay. I'm looking at subparagraph 5 that says a staff of the fund, meaning NHIF, not appointed by the new authority under subparagraph 2 may exercise his or her option to either retire from the public service or be redeployed within the public service.
Exactly.
So the question that I have there is this. Why are you redeploying somebody to the public service, yet he has got the experience? Why spend so much money to train a new recruit? What is wrong with you not retaining that person?
Let me ask you this. Is there a possibility that an NHIF employee may apply for work at the new authority and they are not qualified?
Well, they'll find reasons to disqualify them. Let me tell you, this is a man-eat society, my friend.
All right. Honorable Soro.
You know, that is where this whole thing is. They agree on one point that, like what Honorable Mbuya said, that SHIF is not really a bad idea. But on the other side, they also complain. They say we need restructuring of our systems. Of course, to stop any person, one who knows so-and-so, to call. I mean, we are working to create systems that work. regardless of who knows who in the society. That is on one side. And on the other side, they are saying you want to fire and you bring your new people. Who is this new person that doesn't belong to the president? Because the country is led by one president.
We're told this is a system of shareholders. Come on.
Yeah,
and it's practical.
But I mean, on the other side, you were here on this very show debating on the, distribution of jobs across in terms of the ethnic grounds and everything. And you're being given an opportunity to restructure SHIF. You are again opposing. So what exactly do you want?
Let me ask him a very simple question. KRA, is it equally distributed among the 45 ethnic groups?
I do not know. You tell me.
No, it is not. It's fact. This is not quantum physics.
Is NHIF
currently as it is? Yes.
You see?
Currently as it is?
I mean,
yes.
what favors them is what they want to argue about. But let me dispel this other lie that they've both said that this thing is increasing taxes and everything. Let's be very honest to ourselves. In any case, by the way, this one is really helping the low-income earners and those people who do not earn. Currently, those people who are unsalaried, they pay 500 shillings for contributions in NHIF. This scheme wants to reduce it from 500 to 300 shillings. I mean, how does a reduction of 200 shillings amount to an increase of taxes? Honorable, we should tell us. Number two, a person that earns about 3,000 shillings, as currently provided for in the Act, does not pay this amount. He pays 150 shillings. That is about 5%. If this particular Act goes through and this scheme is agreed and we go through it, he'll pay 82 shillings. That is about negative 2.25%. So what they are not telling you is that they are defending themselves. They're not defending the common Mwananchi. Honorable Ledama.
What did you just say?
A person that earns 3,000 shillings in the current NHIF contribution pays 150 shillings. That is 5%. In the new scheme, this person will pay 82.50.
Are you sure about that?
Exactly. It's 2.75%. Calculate.
As in the president been speaking about the minimum contribution is 300 shillings.
Exactly. But that is... I'm telling you, that is what this person is supposed to. There is a minimum cap, of course, which is supposed to be 300 shillings. There's a minimum cap. So but when you go to the regulation of the...
Can we really use it?
This is what will be used. I am telling you.
But the minimum, according to the president, is 300 shillings.
But this is what will be used. According to the president, read the Act. According to the president, you're saying, you're putting the words in the mouth of the president while reading, you have said...
Refer me to the particular clause. My Act is open here.
What is the contribution? What is the percentage of contribution against the gross? What is supposed to be? What is the provision?
It's not in the Act.
It will be in the regulation, as we've said. It is 2.75%.
So you're taking 2.75% of 3,000 shillings?
3,000 shillings. That will be 82 shillings.
That is the contribution. You think that will be the contribution?
That will be the contribution. Because it's the percentage.
Honorable Soro, my understanding, I could be wrong because I don't make laws in this country, but my understanding is that the minimum contribution is 300 shillings.
Okay.
But for those people that may not afford, the government will pay for them through appropriations in the National Assembly.
Put that on aside and go to a person who is earning 32,000. This person who is earning 32,000 currently contributes 900 shillings. Currently, in the NHIF monthly contribution. That is 2.7%. But if this one goes through, he'll contribute 800 shillings. That is about 0.02%. So is that an increase of contribution, taxes, or a reduction?
But when you look at the totality of it...
The intention of this whole thing, Sam...
Just hold on, Honorable Soro, so that you don't lose that point that you raised there. Yes. At the moment, the maximum contribution to NHIF is 1,700
shillings.
If you put 2.75% without a cap, like Senator Ledama is saying, it gets to 27,000 for someone earning 1 million shillings.
Yes. And that is what Senator Ledama...
If you cap it, then you use the cap that exists.
Exactly.
But obviously, there's an increment in terms of the contribution.
There is an increment on deduction commensurate to what you earn.
Okay.
The low-income earners, there isn't an increment.
But when you look at the bigger picture, the totality of taxation and deductions, pay, you're talking about NSSF, and then...
the intention of this whole, and that is my point, the intention of this whole thing is to achieve the universal health coverage. That we need to get to a point whereby this fundraisers and contributions for people to travel abroad for, health schemes and everything should be stopped. And that is why we are saying Senator Olekina, who wants $1 million, should not contribute 1,700 shillings. He should contribute 27,000 shillings. What is wrong with that? Because ideally, right now, he contributes 1,700 shillings.
Can I respond to that?
And a teacher contributes 1,700 shillings.
He wants you to cap it.
No, can I just...
No, just hold on, Senator. Honorable Soro,
yes.
He wants you to cap it.
To what level? Like, how does he want... Why is he complaining in the first place? He wants it capped, which is okay. But can it cap it to an amount or to a percentage that is commensurate to his earning? That should be the argument.
Okay. Honorable Mbui, your thoughts into this and what you think, because after the regulations come from the ministry, the country is at the mercy of Parliament.
Now, now first and foremost, I think there seems to be some kind of contradiction because if you look at the person that is supposed to be paying 300 shillings from salary, that is a salary that is already below what is allowed in labor by the labor laws of the same the same state.
Let's teach him.
So this is a story, in my opinion, because these people are fond of giving good stories. The real position is that the plan which they had was actually to pay for those that cannot afford. And I think that really is the issue, because you cannot say that unemployed people should be paying, because unemployed people, we should be paying a minimum of, I think, 300. At the same time, you're saying those who cannot afford to pay, the state will pay for them. What kind of contradiction is that?
That is not a contradiction.
If I'm unemployed, why would I make contribution if I am able to get paid for because I'm unemployed?
You may be unemployed, but you're in business.
But then let me tell you this, if you're in business, and that you must note, they are going to take 2.75% because that's a proposal. Anyone with an income, they are going to take 2.75% of that income, and then minimum they have set is 300. So basically the fact is that the amount of money that they're taking from every person's salary is going to go up. The issue that I have with this thing is that, and I've said this, we are already highly taxed. I mean, why can they give us a relief for a short while? You cannot, even Rome wasn't built in a day. I mean, this Kenya Kwanza regime wants to charge for everything overnight. You want to increase savings. At the same time, you're telling us to pay more for our health. At the same time, you want to take more from our incomes. Give us a break. I mean, it's too much, in my opinion. I think the thing is not a bad idea, but they could have retained the old rates that were being charged under NHIF, and then after a while we can transition and charge a little bit more. Some of the biggest problem with NHIF is actually the cartels and corruption that happens in NHIF. Those hospitals that that would make claims that are fictitious. And already this proposal is that the claims department, basically the issue of claims, is being outsourced by the Social Health Insurance Fund. So why can't you even just have amended NHIF and had the same outsourced if you believe that private sector is better, which I don't, in my opinion, believe is necessarily the truth, because you can have structures that are, some training like Olekina has said, some basic training for the staff that are already in NHIF, so that they can improve the systems. Sorry? What if they are part of the problem? Then let me tell you, the law is very clear. You can dismiss, you can discipline, you can fire, and hire new people. But condemning the whole of NHIF in totality, because when you say every member of staff will reapply, even the person who makes tea for the CEO has to reapply to make tea because there was corruption in NHIF, I think is unfair.
Okay. Let me just try to demystify.
Yes, Senator, as you end up on this.
Why this thing is really troubling. Kenyans are already overtaxed. Number one, the housing levy is a haste. In that, we're using public land, we're also using, and then we use public money to build, and then you sell the houses more than the market price. That's number one. Number two, there's an introduction of something called NITA. There's an introduction for more charges in the payee, NSSF, NHIF. And when you look at the issue of NHIF, my brother Mbui has elaborated very clearly on the issue of outsourcing of the claims administration. And I want to be very candid here. All these things, all these pieces of legislation are normally sponsored by special interest companies out there. And you'll find that the companies which will be given those contracts, you know, are associated with very senior politicians. And that's a fact. You know, sometimes I say things and people think this guy has smoked some marijuana. But the truth of the matter is, that is the truth, you know? And number two.
You suspect that to be the case?
I don't suspect. I know it is the case. What are you talking about?
No.
You know, I'm not suspecting anything. Let me tell you, you know, in developed nations, there is lobbying. You know, lobbying. There is sort of like kosher corruption. Here in Kenya, there is true corruption. You know very well, this housing levy, the people who are building the houses already have contracts for the houses. Okay? I mean, seriously.
Who are those?
See, there are people who are connected with the high power, the Kenya Kwanza administration, these guys. I'm pretty sure he has got a few contracts.
No,
you know, so really, we have to be very clear. When you look at the NHIF Act, as it is right now, there is enhanced cover. That enhanced cover in this social health is gone, you know? Yep. So you'll not find that people who are working so hard, you know, and they get more benefit will not be able to get that as well. And you see, you cannot say that, oh, we are trying to now improve, you're trying to improve healthcare, when we have dilapidated health facilities. I was in Narok over the weekend, you know, doing my oversight. And you'll go to a hospital in a place called Sakutek. The hospital has got nothing in it. And you're telling me you're going to charge those people, you know, that amount of money, and you cannot even, and even when they requisition drugs for 300,000, you only take them drugs for 100,000. You know, we need to really ask ourselves some very serious questions. You know, health is devolved,
right.
Fully devolved. You know, why are we leaving so much money in the national government? Why are we putting all the money in the Ministry of Health? You know, forms follows functions. So here, what we should be doing is we should be looking at the entire, you know, the entire country and say, there is not equality. How can we be equitable? You know, to ensure that even those people who are in the rural area, you're already overtaxing them. If they have a bag of potatoes, you charge themselves for 50 bob. You know, maybe they go there, you don't even give them a road. So really, you know, we are behaving as if we live in a first world, forgetting that we live in a dilapidated, corrupt, environment, which we are led with people who are sycophants. My brother here will talk about this. We'll talk about this, the SHF Act, and I can assure you, he was busy politicking, not even reading the content. He'll be the first one telling me, boss, I tunalipa yote. I tell him, that is a fact. You know, so seriously, we are having a very serious problem. And all this is because we have allowed to be married by the IMF and the World Bank. You know, that is the biggest problem. They are the ones who are dictating, do this. And they are not here to see the challenges that we are facing. So in my view, let me be honest with you.
Right.
This will collapse. There'll be a myriad of cases, people filing lawsuits on a daily basis. The employer right now, Mbui, I'm sure Mbui is an employer. My brother here is a big employer. He contributes to all his employees, you know, to give them morale to be able to work. Now with the new act, the employer is not contributing a penny. Come on. And you're telling me we are trying to build a country? We are destroying this country.
Number one, let me also tell my friend, he's my friend, but not political friend, though. Like he said, that should be clear.
Yep.
That I was part of the team that came up with the plan. And this was one of our plans. So I am part and parcel of this whole thing, and I'm well-read. And I really understand the whole thing. I don't know why he's telling me that I didn't.
But he's just telling us 2.7% of 800.
Exactly. Let me then say this. That the country has only about 3 million employed or salaried people. The entire country.
You mean formal employment?
Yes, formal employment.
Yeah.
And it's just about 54%. Yes,
don't ever use that word, formal employment. Seriously.
Yeah, it is.
Even farmers are formal employees.
I'm talking about the statistics, how they have been defined.
Exactly.
Because we are colonized.
Exactly.
Okay,
3 million.
now,
so just about 54.
Senator, either we agree to use the statistics as they are, or we provide alternative. Because it talks about 3-point-something million formal employment.
Exactly.
Over 15 million informal employment.
Yes, we have to do away with that word informal. Everybody, a farmer is formally employed to be a farmer.
Okay. Senator is a farmer, so he's formally employed. By the way, he's a great supply of milk. But that aside, 3 million people who are formally employed, let's use the the research as it is just about 54% that will get an increase of, 54% will get a reduction on the premium they will contribute out of the statistics that the Ministry of Health has done, and just about 46% that will get an increase. But what is the motivation of this whole thing? The intention of this whole thing is to make sure that every person is covered. We need to be our brother's keepers. Just like the housing scheme and everything, we need to get to a level where we, like developed countries, like other developed countries, that we want to get to a level where getting health services in this country is almost entirely like free. Because you've contributed, you can walk into any hospital and get services. Although I want to agree with the Senator on only one thing, that despite the devolving health to the counties, and this is the only point I'll agree with him, the challenge you're having is that our hospitals are really not well equipped. Of course, he'll argue from the point of not getting them not getting enough money, of course, to do what they're supposed to do. But I'll say, even the little they are given is not really visible, is not doing much. I'm one of the people who's on record having said that I think we must have hurried this devolution thing, because I don't really see it working. Had we gradually gone...
I want us to tie at that point, because you're saying that once people contribute, they'll get free medical services.
No, what I'm saying is this.
Yeah.
We want to get to the level whereby one can walk to any hospital and get your services and get treated and go home, whether you have money or you do not have. That is the dream of this whole thing eventually.
Don't you think taxes should play a significant role in that? Because the same people you are saying that the contributions will be increased or reduced, they're also paying taxes, aren't they?
You know, taxes is a contribution towards development of your country or paying for this, several other services. It's not really squeezed within just the health scheme. This is particularly for the health structure and the health scheme.
That's what I'm asking. Shouldn't taxes be doing that? Because if already you're spending close to 30% of revenue on education, when you get to a point that it's no longer sustainable, are you going to introduce an education levy?
Oh, of course we can't get to that level. What I'm saying is this.
No, taxes, there's already a health levy.
The taxes, exactly. But this has been there. Why? We need to go to the history on how or why NHIF came into place. It is to complement what other tax avenues are doing. This is a complementary contribution per se on what the other tax avenues are doing. Because the other taxes that we are contributing, of course, go to the counties for building hospitals. So then pay these other health scheme funds for you to get treated, to buy medicine and other things. So the other taxes will help you build hospitals, like you said, and this one also helps on the other, running cost of running the hospitals. But again, there's another point they've said. The NHIF employees will not be fired, and that is a lie. It is a normal political statement. You've actually read it yourself, that in the event that these people appear not, after they appear, of course, they reapply and they go for vetting and everything, and the corrupt officials, like you said, there are people within the structures of NHIF who are corrupt, you know. Some will be charged, of course, I believe, if it's found through the systems that these people are corrupt. But those who are not found fit to serve in the NHIF will be redeployed. What is wrong with that? You are being redeployed. You are an officer. You've been employed in this government.
What if you're not redeployed?
But that is what the Act says. Yeah, you will be redeployed. That's what
it says.
That is what it says.
What if you're not redeployed in a sense that your services are not needed by any other...
No, it can't go that way. But if it goes that direction, no, you'll find other mechanisms of doing another thing. You see, Sam, today here, you're sitting...
What do you mean with that?
If you really feel that you've been unfairly denied your right of working, and you feel you're eligible and you've been unfairly dismissed, there are so many avenues of seeking restitution. But that is not something that we really envision. People will be redeployed. Sam, today you're in studio. If tomorrow you are redeployed and you're behind the camera because you're a media personality. I mean, you're working, you're still working. Why would you insist that you must be before the camera? Why? You're working.
A different profession.
I mean,
it's okay.
You know,
if you are a police officer,
you know,
and you've
he's trivializing this matter.
You're in the general duty, and tomorrow you are told become a DCI officer. You're an officer. You're still working. You haven't been fired. Stop politicizing this whole thing.
That is not an example of the plan.